Most of us are carrying a heavier load than we like to admit. Between managing workloads, navigating relationships, and just trying to keep up with the daily grind, the baseline level of stress right now is remarkably high. Yet, despite carrying all that weight, a huge portion of people never reach out for professional support. Ask someone why, and 9 times out of 10, you get the exact same answer: I can't afford it. For a very long time, that was a fact. Getting a therapist traditionally meant paying massive out-of-pocket fees, taking unpaid hours off work, and treating mental health care as a luxury reserved for a select few. But the healthcare landscape in Georgia looks very different today. The old math dictating who gets care and who gets left out has been rewritten. The real reason thousands of Georgians aren't getting the help they need isn't a lack of money. It's a lack of information about what's actually available right now. To see how the numbers actually break down, we have to look at coping and healing counseling. Founded by licensed clinical social worker Eliza Joseph, CHC set out to strip away the financial barriers blocking mental health care across the Southeast. The traditional rate for a therapy session sits around $150 to $200, but for CHC patients with major commercial insurance, that cost shrinks down to $10 to $40. With Aetna, Cigna, or Humana, copays often cost less than a streaming subscription. And for Georgia Medicaid, the out-of-pocket cost is exactly $0. By cutting the out-of-pocket fees down to these levels, professional mental health support stops acting like an exclusive perk and starts functioning as an accessible, everyday utility. Even if the session fee drops to $0, the traditional therapy model still charges you. You pay for fuel, parking fees, childcare, and lost wages from leaving early. This receipt maps those secondary costs, but CHC operates entirely through secure telehealth, crossing out gas, childcare, and commutes. Evening and weekend appointments let you maintain your schedule. And instead of waitlists, CHC has over 15 therapists covering all 159 Georgia counties. When you delete the drive, keep your work hours, and skip the waitlist, the functional cost of attending a session drops to $0. Still, many people talk themselves out of booking an appointment because they assume therapy is strictly for severe, diagnosed clinical conditions. They think their problems aren't serious enough to warrant a professional's time. The reality is much more relatable. The bulk of modern therapy is focused on everyday people managing standard life friction, transitional stress, and grief. You don't need a medical diagnosis to deserve a space to process your life. But even then, there is a very real fear of logging into a session and realizing your therapist doesn't understand your background. Nobody wants to spend their 45 minutes explaining their culture instead of working on their actual problems. To solve that disconnect, CHC intentionally built a diverse roster of licensed therapists. They operate on the principle that providers should accurately reflect the specific, lived realities of the communities they treat. Fixing the pricing model and building a massive telehealth network wouldn't matter if the clinical environment didn't feel safe. Culturally competent care is what makes the entire system work. The 3 massive walls that historically kept Georgians out of therapy, prohibitive session fees, impossible travel logistics, and cultural disconnect, have been dismantled. High-quality, specialized care is now available on a schedule that actually fits your life. You can attend a session from your living room sofa, your office break room, or even your parked car on your lunch break. The money excuse is gone. The time excuse is gone. The location excuse is gone. When all the external obstacles are removed, the only thing left keeping you from feeling better is your own hesitation. You have the information now. Reach out to Coping and Healing Counseling at chctherapy.com or call 404-832-0102 to schedule your first session. In Georgia, the obstacles to mental health care have effectively disappeared. The only remaining step is deciding to start.